Welcome back to part 5 in this series. For those of you who didn't see the last video, my name is Emma Gatehouse and I'm the resident in Veterinary Behaviour at Langford Vets. This is the final part in this video series, and in this video I'm going to give you some take-home messages and way that behaviour can support diagnostic in practice. Behavioural science can give us an insight into both the emotional and physical health of our patients, and it is important that these signs are not neglected in order to improve the diagnostic process. Small amounts of information provided by the caregiver or another member of staff may be critical to investigating specific disease processes and should not be ignored. Whilst working up cases with behavioural changes, it is important to consider the role of physiological disease and ensure that adequate investigations have been performed. This will allow us to rule out pain, neurological, gastrointestinal, endocrine and dermatological disorders, amongst many others. If medical disorders have been adequately ruled out, then we must also consider the role of the environment and impact that this may have on our companion animals. Is the behaviour abnormal, or is the environment and the amount of triggers the animal is exposed to abnormal? How much has learning played a role in the behavioural presentation? All of this must be considered in the diagnostic process. As we mentioned earlier on in this series, collaborative approaches between team members can really improve clinical outcomes, with behavioural support intertwining with medical treatment. Often, small adjustments and support for caregivers can make a significant difference to how a case progresses, how that animal takes their medications, how much they rest, how much sleep and recuperation they can achieve. Monitoring behavioural outputs as well as disease progression is also essential for ensuring a good quality of life in chronic conditions, and that we're picking up on changes as soon as possible. Regular communication between caregivers and professionals allows for this to occur, and client support needs to be met whilst navigating these often complex cases. A wide range of guidelines are now available, including feline and canine friendly practice schemes and low-stress handling methods to reduce the impact that managing animals within the hospital environment may have. It is essential that the entire team is on board to facilitate early recognition of anxiety, fear and stress in the practice, and to be able to mitigate these where at all possible. So, take-home messages from this video series are that behavioural and physical health are intrinsically intertwined. Behavioural changes are often the earliest signs of disease progression or chronic stress in our dogs and cats. Stress and pain don't just affect mood, they influence multiple physiological systems, from endocrine, gastrointestinal to immune. By integrating behavioural assessment with medical evaluation, we can improve diagnosis, treatment and overall welfare of our patients. Evaluation of behavioural health shouldn't be optional. It is an essential component of comprehensive animal care. Thank you for listening. That is the end of this video series. If I could encourage you all to like and subscribe to the Langford Vets YouTube channel, we would be very grateful. Thank you very much for watching. And finally, thank you to SIVA for sponsoring this series of videos.